Assalamu alaikum, peace to everybody. This is actually, what this is a talk that Chris and I have been giving across churches in South Central Los Angeles, as well as to Cal State Los Angeles and Cal State Long Beach. Blurring the dichotomy that we talked about earlier in this morning of blurring the line between consumers and professionals, because Chris and I are both, and also between spirituality and mental health, which again, like the speaker said this morning, we consider a false dichotomy. I was thinking of once when I was thinking about how I was going to lead off, and we're going to do this a little bit backwards from the outline. We're going to talk about spirituality first and go back to self-disclosure, as I think in the outline it's the other way. But like I said, we've done this talk for a while, but this is a lot different setting and audience, so we were trying to tune it to make it something that would be worthwhile for your participation today. A number of years ago, a clergy friend of mine, as an Episcopalian minister, told me that you have to remember in our faith tradition, resurrections, our stories, that resurrections happen in surprising places when you least expect it, and in conditions that you would not think would lead to resurrections. And I think that's what Chris and I are going to talk about today, is resurrections, personal and the people that we work with. Dr. Southard mentioned Christopher Hitchens, which I found interesting because that was on my notes. I used to be a big fan of a website called edge.org. It's a website for researchers in psychiatry, statistics, research, philosophy. And it's some of the latest breaking work, but in the last year it's become disturbingly partisan, I hate to say, I guess is the right word. And the people that Dr. Southard mentioned today, Dawkins, Hitchens, you had Steven Pinker and some other folks, they've developed this intemperate attack on faith. And Hitchens made a comment recently where he said, we don't need faith because we have science. Science is a better explainer. Science is a better predictor. And someone wrote back and said, that's nice, but just because I know how the toaster works doesn't mean I shouldn't read Chekhov. And so I've become a little demoralized, and I don't look at the website as much as I think, because in their point of view, anyone who has faith is a step away from being a terrorist, which is, for people that intelligent, you're thinking, how could you come to such a conclusion? And I'm thinking, as we look at the conference for the last 2 days, it's really faith and hope that makes everything we do worthwhile. If you don't have faith and hope, we're just spinning our wheels. I think, faith is what took a group of slaves in the most powerful empire of its day, Egypt, took them across the Sinai Desert and formed an ethical and philosophical system that still influences today. It was faith that took a bunch of feuding tribes in Arabia, caused them to join together and form one of the most enlightened civilizations of all time. My first job out of graduate school, I was hired to put together a parent support group at a synagogue. And I went to USC. We know that's not a cheap school, and I thought I had to justify my tuition price, so I had to come in very knowledgeable with all the latest research and people. And I was very proud of all I had to say to these parents, and then the rabbi said, and that reminds me of what Rabbi so-and-so said in the 13th century. And it was the same thing I had said, but it was 800 years old. And I realized, wow, this isn't new. People already know this. I think of, in the Arabic world, a lot of what we know about Plato, Socrates, and Aristotle was preserved by them. And there was a great teacher, Ibn Sina, in the 10th century, who would be perfectly at home in the recovery model with the way he treated his clients humanely. And they built some of the first, probably what we would call mental health facilities. So what we're doing is nothing new, as Solomon says, under the sun. Sometimes we're just rediscovering the wheel or reinventing it. But they had actually had one of their diagnoses in the Arab world, I think was interesting. It was called black love. And it was the loss of hope. It was the idea that you longed for something so intensely that was never going to happen. And they had a way of treating it in a very humane, calm place to help people work through that. So whoever creates this idea that mental health and spirituality are separate issues, through most of history we know that's not the case. When I went back to college, I don't remember my dreams. They're really boring. They're pathetic. I'll wake up and I'll think, brain, is that the best you can do? The real world's much more interesting than that. But the week before I started my first college research class, I had a nightmare. And in this dream, I was a reporter at the time, and I get a phone call, and this guy says, I have information on the Black Dahlia killing, which I'm probably mispronouncing it, but it was a horrible murder that took place in LA that's not been solved. He says, I know who the killer is. Will you meet me? And I said, wow, this is great. This is going to take on my career. You know, I'm going to have a scoop. Not thinking I'm writing a story about a poor, scared woman who died a horrific death. That kind of tells you a little bit about journalism, I suppose. And I met this guy, and he kind of looked like B.F. Skinner in the dream. And as he started talking, his body started shriveling. And one part of his brain lobe started growing hideously large, and the rest of it started shrinking. And I woke up just really shaken from this dream. And if it had a meaning, I think it was that sometimes we focus on such a narrow set of skills and what we think is reality that we create something that's twisted beyond belief and inhuman. And it was a lesson to me, not a lesson I've always followed in my career, that to keep a balance between all things. To sort of wrap up this beginning piece, my first day as an intern, I was at a clinic that had never had an intern before, and the director was a little bit of a nervous control type person, and she didn't know what to do with me. This is an intern. He might make a big mistake. I don't know if that meant we'd get sued or the clinic would have a nuclear implosion and sink into the ground. So she put me in a room and just told me to wait while they figured out what they were going to do with me. Well, this woman comes in an hour and a half before her intake, a 24-year-old woman who just got out of prison. And they said, well, let's put him with the intern. I mean, certainly in an hour and a half, he's not going to hurt her. And so this woman had no affect, no features. She had just got out of prison because she was in the family business, which was crime. Her brother and dad were in prison. And I'm looking at her, and she's looking at me. And I said to her, I don't mean to be rude. I'm trying to imagine what it's like to live in a world where you're just a number and a label, and people have no idea what you're like as a person. And we got talking for an hour and a half. Well, she left, and she wasn't my client, so I didn't see her. At the end of my year there, the clinic was still standing. I hadn't destroyed it. So they decided it would be a good thing if I sat in a adult diagnosis group. And so I sat there, and it was a really lovely group of people. You know, they're in recovery. Things are happening in their life. And there's this young woman who's the star of the group. She's a nursing student. She's full of life. She's clean and sober. And at the end of the meeting, she came up to me and she goes, you don't remember me, do you? And I embarrassingly said, no, ma'am, I'm sorry, I don't. She goes, when I first came into this clinic, you listened to me like no one in my life has ever listened to me. And it was humbling because my intervention was purely accidental. I didn't, work with her in cognitive reframing of her maladaptive thinking. We didn't talk about her serotonin level. I didn't facilitate connections with traumatic incidents in her past and present behavior. I just talked to her as a human being. And that gave her hope. And I think that's the bottom line of hope. There's the old saying, if we have a why, we'll always find a how.
Now, I got to make sure I'm doing this right. Am I talking about the right level in the speaker? No? I can never do this thing right. Okay. And I'm going to take a minute to get on the PowerPoint, too. Technological distractions here. And then I'm supposed to do that to make it bigger. Okay. All right. I did it. So that's so we're advancing. We're trying to advance into the 21st century. We haven't quite made it yet. But so I'm a psychiatrist. I work at the Rio Hondo Mental Health Center. And we're going to talk about disclosure in a number of different ways. We're saving that portion till the end, but I'm going to make a couple disclosures in the beginning. I'm also a mental health client. I have been for a number of years, and had very bad depression. It ruined a lot of my 20s, but but that's an old story now. And I love stories, and my story keeps changing, and it keeps getting better. And I've been speaking like this for a couple of years now, and I've gone to mental health professional conferences, client-run conferences like the California Network of Mental Health Clients, the National Alternatives Conference, and I've been a speaker there. And at some of those client-run conferences, they expect just about everybody to be a client, but they don't expect psychiatrists to be there. And so when I get introduced as a psychiatrist, they're a little leery. And, they're asking, well, do you push medications? Have you done shock treatment? Have you put people in restraints? Because a lot of these people have been traumatized by psychiatrists and by mental health services. And so at one of these meetings, there was a woman that I recognized, and we both got excited. She said, hi, Chris, and I said, hi, how you doing? And then she introduced me to her friend, and then she very, in all seriousness, kind of came close to me, and she said, is it okay if I disclose that you're a psychiatrist? And I thought about it. No one had ever asked me that. We wonder, can we disclose that we're a mental health client? But can I disclose that I'm a psychiatrist? I said, well, yeah, I gave my consent. And she said, disclose away. And she told her, this, my friend Chris Camilleri, or Dr. Camilleri, is a psychiatrist. And she accepted me, even though I was a psychiatrist. And that was really, I felt all warm and fuzzy, And so, but that's sort of the flip side of what I deal with when I'm a mental health client, when I've been in different settings. It's only been in the past couple of years I made a decision that I got nothing to lose, so I'm going to let people know about this. And I haven't lost my job yet. I've been doing okay with it. And so what I did was, the Journey to Wholeness is the name of the conference. I looked up the word wholeness, and some of the definitions, it said it's not broken or damaged, it's not injured or impaired. And I think that's a partial definition, because what I think of, it's the more complete definition, or the more whole definition, would include something like things that have been broken and are healing. They've been wounded and they're getting better. And I would even get biblical or spiritual about it and say it's things like what do they call it? Every valley, or no, every mountain and hill will be laid low, and every valley will be exalted, and something about the lame will walk and the blind will see, and those with disabilities will begin to see their abilities. And if not completely seeing their abilities, at least partially, they'll see themselves in a new way, and then others will be able to see them in a new way, where they'll be able to recognize their gifts that they have to offer. And so they won't be seen as permanently disabled. They'll be seen as having gifts that they can give. And there's a story I love about, I call it the broken vase. It's about a young man. He's perhaps in his early 20s. And he's good looking, does well in school, he plays competitive athletics, he drives fast cars and dates beautiful women. And he's diagnosed with bone cancer in his knee. And a couple weeks later, he had to have his leg amputated above his knee. And this is a true story from Rachel Ramon's, Dr. Kitchen Table Wisdom. And so, now, while that saved his life, it also ended his life as he knew it. He had to quit playing competitive sports. He dropped out of college. He started drinking and drugging. He became angry and resentful, and he got into one car accident after another. And an old coach that he had hooked him up with a therapist. And so as he was talking to the therapist, she could see that he was resentful and angry and isolated. And so she was trying to help him get at his feelings, and so she took out a pad of paper and said, could you draw for yourself how you see yourself? And so he got a black crayon and drew a picture of a vase, and he was holding the crayon really frustrated and gritting his teeth, and drew a crack, a broken line right through the middle of the vase, through like tears of rage. And she said, well, what does that mean? And he couldn't quite get at it, what it meant, but to me, when I was reading that, it meant that he was like an empty vessel. He felt useless. He felt like he was broken. And so, he started talking about what it was like, and he said the doctors don't understand, the medical profession doesn't understand what it's like to, you lose your leg, and they don't get it. And so she could see he was very angry. But he started bringing back stories of other people who had problems and who had been burned and who had amputations. And she could see he was trying to understand this, but he was very angry. And, he kept on saying the doctors and the medical professionals don't understand. And she said, well, you might understand. It sounds like you might be able to help some of these people. Why don't we set it up so I'll send you to some of these people with these problems who have amputations and they're in the burn unit, and you go talk to them. And he said, nah. But then he thought about it. He said, okay, I'll try it. And so he started seeing these people, and he was connecting with them, and he brought back stories of how he was delighted. He was able to connect with them and give them hope and help them. And so he was, also talking to the doctors, and the doctors were talking to him about some of the frustrations they had in the work that they were doing, and they were referring to him other people, and he had a newfound respect for some of the doctors and some of the medical professionals he was working with. And so as he was getting towards the end of his therapy, he had developed his own ministry to speak of, and the therapist got out that pad of paper again with the vase on it, and he said, it's not finished, the picture's not finished. And she kind of said, well, what do you mean? And she gave him a crayons, and he took a yellow crayon, and in the middle of the vase where it was broken, he took the yellow crayon and drew rays, like of light, to the right and to the left of that vase. And she looked kind of puzzled. And so he said, well, the part right there where it's broken, where seems like it's ruined, that's where the light comes out of. That's where the light shines from. And so that's the way I see that, as a broken part of ourselves, which we thought was ruined and useless, is where our gifts come from, and that's where our strength comes from. And I really love that story. And so I think that everybody's been wounded at some level, and so all of us, whether we had a serious mental illness or not, if we can get in touch with the part of ourselves that's been hurt and wounded in some way, we can connect better with the clients that we're trying to help. And we see ourselves as more similar to them rather than so different from them. And I think that we have a lot to learn. I know I always feel like I'm learning from my clients. And when I'm telling them things that they should be doing, I know, oh, God, I should be doing that too. And so it's always a learning experience for me. And I think that, I see my goal as helping them to discover the strength that's within them. And I wanted to shift gears a little bit here. And this is you got to put on your thinking caps for this one, just for a minute, and talk about placebos. And a placebo, like most of you guys probably know what it is, but basically when they determine if a medication is helpful, they have to compare it to an inert medical or chemical substance, like a salt pill or a sugar pill. Well, salt and sugar aren't really inert, but basically for depression, if like Prozac and Zoloft had to be compared and be shown to be more effective and at least as safe as a placebo. And they find in a lot of these studies that 1 out of 3 times, like 30 to 40% of the patients respond to a placebo. And then maybe 50 or 60% of patients respond to the medication. So what is it that they're responding to? It's an inert medical or chemical substance, but they've been given to it by someone who said this might help you. The person who's given it to them also doesn't know what they're giving. It's called a double-blind study. And so there's something about that relationship of helping, that Steve was talking about when he was just sitting there talking to that person. He wasn't doing any, sophisticated technique. He was just there listening and talking and supporting. There's something about that relationship. I would call that spiritual, that supportive relationship. It's something more than medicine and chemistry. And so, we've heard a lot of talk about hope and how hope is really important. And as someone I really admire said that mental illness has a lot more to do with the loss of hope and the loss of dreams than it does to do with the loss of dopamine and serotonin. Serotonin and dopamine can help, but if you don't have hope, then the serotonin and dopamine aren't going to be able to do very much. And so I think of recovery as growth-oriented, reaching out towards your next goal, a small goal, but not a large goal necessarily, rather than being risk-aversive. patients will say, "Oh, doctor, can I ever work again?" And I never say, "No, you can't." And I don't say, "Well, yeah, I mean, next week you're going to be a CEO or something like that." But, just that I always say that things are possible, and let's work at this, and let's take an optimistic view of what can happen. You can get better. And I think that so people need to take on meaningful roles. They have a purpose and a feeling of purpose. That's been very important. That's been talked about, and a feeling that they're responsible for what they do. Not that their doctor's not responsible, their parents aren't responsible, and taking chances. To me, it's all about taking chances. That it could be taking a class. It could be trying maybe a new group or going to a 12-step group. You have to believe that something better can happen. And another story that I like is one of the clients that I had. She had been in prison and jail for a number of years. She had been on amphetamines for a number of years. She'd been clean and sober for about 2 years. And I was treating her for depression, and she was actually a sober living home manager. And she, there was some stress in that. I think it was men and women, and there was all kind of chaos there, and she was feeling anxious about that. And she had just broken up with her boyfriend, and so she was kind of depressed. And so she was worried that, maybe we should raise her dose of medication. And so we talked about it, and, I said, well, I mean, from what it sounds like, you're handling a lot of responsibility. You're in a chaotic, sober living home. I'd probably be pretty anxious myself. And, she had just gotten accepted to this program for being a dental hygienist through Voc Rehab, but she hadn't been to school in 10 years. She was a little anxious about that. And I just kind of looked at it and I said, I think you're doing really well, and anyone in your situation would be a little bit depressed and anxious. It's just she was actually delighted that I didn't want to raise the antidepressant dose. And so she looked up at me and she said, Dr. Camilleri, I have a chance. If I complete this program as a dental hygienist, I can end up working a full-time job, and I could get out of this sober living place. I don't need to live in that chaos. I could have my own place. And she looked me right in the eye. She said, "This is a chance of a lifetime for me." And that really moved me. I just felt like, wow, she's come a long way, and she's ready to take like the next chance, the next step in her life. And and that's what we need to do, and we need to encourage our clients to do. And I'm going to tell a little bit about my story. I basically, and I've told my story many times, so I know some of you have heard this before, but so some of it doesn't change that much, but a lot of it does change. In telling my story, and part of it is seeing myself in a different way. And as I change the new chapters in my story, I kind of see what happened in a different way. And I was an average child in a middle-class family, and I had some good friends. I was a good athlete. I was a good student. But for some reason, a long time ago, and it's only been in the last few years that I realized this, I developed this mistaken idea that I had to become a scientist and make earth-shattering discoveries. And I don't know if it was like in physics or neurobiology, studying the brain, and that came to haunt me later. And so things started to fall apart in my last year of college, my senior year. Things had gone okay, but all of a sudden, I don't know, it was like October of my senior year, and I started feeling like I didn't want to get out of bed. I felt like crying, and I was crying a lot. I was isolating. I started taking fewer classes, and it was just harder and harder to get things done, harder to socialize, and I started having panic attacks. And if I was driving, I'd have to pull off the side of the road because I couldn't focus. And I started feeling like I didn't want to live anymore. And I was considering dropping out of college, but my mom sort of convinced me that it would be worth trying to eke it out because I only had a few more classes to go, and most of them were electives. And so I actually managed to scrape by and finish. But I didn't know what to do next. It was unsure. I had been doing some research in a neurobiology lab studying REM sleep and narcolepsy throughout, you started in high school and part of college. And I started doing maybe PhD in neurobiology or maybe psychology because I'd been, I had eventually started going to some peer support groups and a therapist, and I was starting to get a little bit of help, but you know, I thought medical school, psychiatrist, or pastor, you know, because spirituality was becoming important to me, but I had no clue. And so I ended up being a van driver for a hospital for a couple years. I drove patients to their appointments for 20 to 30 hours a week. I did that for a couple years, and then I landed a job as a research assistant, full-time, working for the guy I had been doing part-time in college for, REM sleep and narcolepsy, studying the basic brain mechanisms of those, of REM sleep and narcolepsy. But every year it seemed to happen again. This was going on for about 6 years, and it lasted about 6 months, these depressions, and I was becoming in such great pain. I thought the pain was never going to end, and I remember many times thinking to myself, if this goes on much into my 30s, I'm going to have to end my life, because I was not going to be able to tolerate that pain for that long. And so I started giving up the hope of having a future in a career, in relationships and friendships. And, you know, it was very, very difficult 6 or 7 year period for me. So I had to find hope. And I wasn't quite sure how I could find hope. But I was going to these client-run groups, and I was seeing other people who seemed worse off than me sometimes, and some of them were getting better. And so I thought, if these guys could get better, then surely I could get better too, because some of them were doing worse than me. And some of the, you know, I was going to church, and I went to actually some 12-step programs, one called Emotional Health Anonymous, and one of my sponsors told me to go to AA, because so there's some really strong program. I didn't have an alcohol problem, but I would go to those meetings just to hear the hope, because I heard some of these people getting better, and some of them had way worse problems than me, and homelessness and depression and alcohol and drug abuse. And I thought, my God, if these guys could get better, then surely I could. But it wasn't kind of sinking in. And my therapist had kept on suggesting, try a medication, Chris, try a medication, Chris. I said, you know, I had tried one in college, and I had these bad side effects, and I had blurry vision. I remember I was playing basketball at UCLA in the gym, and everything got blurry, and I was scared, and I stopped taking it. I don't want to take medications again. But then it was a couple years later, and I was getting more desperate, and it was getting worse. And so my therapist, you know, finally convinced me I should try a medication. I tried a couple different ones, and I eventually got on one MAO inhibitor. It's from like the 1950s, and it actually helped. It gave me a boost of energy. I felt a little more social, a little more hopeful, and I had problems with side effects, but it really did help. And I'm actually not taking medication now. I've kind of gone off and on it, depending on how I'm doing. And yeah, so like I said, looking back, this idea that I had to become a scientist that made an earth-shattering discovery, that was a big setup for depression. You know, because how many people are going to make a big discovery like that? Well, it wasn't too funny back then, but okay. And so at about 25 years old, I was still living at home, and I got this new job as a research assistant. And then my mom gets the bright idea that it's time for me to move out. So she goes and puts a down payment on a townhome. She didn't tell me about it. She comes home and she tells me, you know, you can move out now. And, you know, well, thank God I didn't think about it that much, but I told her I can't afford it, you know, because I think I was making like a couple $1,000 a month as a lab assistant, and the payments were like, I don't know, $1,300 or $1,400. So, you know, how am I going to pay for food and gas and all that other stuff? So she said, well, you know, you can get roommates. I said, oh, okay, I'll get roommates. All right. So I moved in, but she was really trying to help me grow up, you know, and that was really a gift she gave me. So I worked in the lab for a couple more years, and then I had an unfortunate tragedy occur in my life, which was a turning point in my life. And up to that point, I had this 2-year rule that I had said to myself, if I could just go 2 years without getting depressed, then I could maybe apply to graduate school, or then maybe I could get in a serious relationship. And so, well, so what happened was I was on vacation, and we were driving in British Columbia with my mom and 2 brothers, and there was a car accident. We were in a car accident. I had a bad head injury, and I was in the hospital for about a week, and I was almost in a coma, but not quite. I was falling in and out of sleep, and I don't remember anything for 2 weeks. Then I started having memories. My memory started coming back, and but my mom and my middle brother were not so lucky, and they were killed in the accident. And so I didn't really even realize that because of the head injury. And so it took me a couple of weeks until I kind of like, oh, this is what happened. And I was like, oh, God, you know. And so I just, I went back to work a month later. My boss is such a kind man then. He was the guy who's the neurobiology researcher. He's still at UCLA now. I talk to him every couple of years or something. Very kind man. And it took me a full year to stop thinking about this, like all the time, all these reminders that would come in. And I had a good reason to be depressed then. So, but what it also did for me was that 2-year rule got reevaluated. Because I said to myself, if I have to wait 2 years of not being depressed to go to graduate school or get in a serious relationship, well, I actually don't even know if I'm going to be around in 2 years, because something like this could happen again. So I decided that I'm going to go and take a chance. And so I started trying to figure out what I'm going to do next. And to make a long story short, it was after a couple years, I had got into medical school. And I decided eventually to go into psychiatry, because I got some help from psychiatrists and from therapists. And I thought, well, I'm interested in science, and I want to understand this better. And although I have not made any earth-shattering scientific discoveries at this point, I made a very important personal discovery, and that is that I don't have to make that earth-shattering scientific discovery. I just have to be just like everybody else here as a child of God. I'm enough just because I'm here, and I don't have to accomplish anything big. I can just be myself, and I'm learning that more and more. That kind of takes a while to absorb that. I don't have to do anything. I don't have to please anyone. And it's about accepting ourselves, both in our weaknesses and our strengths. And as I've heard here, I just put this in that 80 to 90% of us, or mental health clients, consider spirituality important. And so that's got to be something we got to consider when we're seeing people. You know, that's important to them. How are we going to help them unless we pay attention to what's important? And I heard reading a recent definition of spirituality. It's opening to a larger reality than your own ego. And it could be opening up to other people, and it could be opening up to a higher power. And I think it's a belief in a higher power that power is within us, and it's in between us. It's in helping other people and trying to give them hope and attempting to understand other people who might be different from yourself. Yeah, and helping them to find what their inner strength is. And helping them to find a belief that things can get better, that things can change, that yes, you might be able to work someday, or yes, you might be able to have a relationship someday, or yes, you know, maybe this doesn't have to last the rest of your life. And so it's also about letting go of the old unhealthy ideas that are no longer working. You know, maybe the ones that you learned growing up, or maybe from some trauma that you had that you assume you can't be safe anymore. So it's letting go of those old ideas that aren't working, and saying yes to something new, saying yes to taking a courageous step of faith into trying and acting on a belief that things can get better. And so what my belief is in people who've had an experience of mental illness, they've often suffered some traumas or wounds, and I think a lot of times our gifts are connected to those wounds. So someone maybe who was in a chaotic family with a lot of anger and a lot of arguments and yelling, maybe they'll become good at conflict resolution. But then maybe their weakness will be they have a difficulty with disagreements. They want to keep the peace. And so sometimes your gift is also connected to your weakness. But I believe that if we allow mental health clients, and also people who aren't mental health clients, but we get in touch with what our gifts are, and we encourage people to use their gifts to help one another. And this is why I think the idea of having peer advocates who had the experience of mental illness, now they're allowed to help other people because they have special gifts, then our community is enriched by that. And if we don't allow that to happen, we're impoverished. And I think that's I don't know, how are we doing on time here? We got a little bit more time. I'm going to tell one more story. I like this story that I read. It's about meaningfulness and hope in the work that we do, and bringing the work that we do, combining it together, and to help the community. And it's this parable. It's about building a cathedral, and when I read it, it was in the 14th century, but it could be building a cathedral today. And we come up to these three men. I guess they were men back then. They could be women too, but three workers, and they're stone cutters. And you ask them, well, what is it that you do? And the first one, he said, kind of frustrated. He said, well, I cut stones, and they're a foot by 3/4 of a foot. And you know, I've done this all my life, and I'm going to do it until I die. And then the second one, you know, when he asked, well, what do you do? He said, well, he said it was a little bit warmer when he said it. He said, you know, I cut stones, the same, you know, same size, and I'm doing this to provide food and clothing for my family. And I want to create a strong family and provide them with a house. And then the last stonecutter's answer, it gives us pause. And he says, in a really joyous kind of way, he says, you know, I cut stones the same size also. And I'm doing this because I have the privilege of building a cathedral that will shine brightly in the community for 1,000 years to come. And I believe that that's what we're trying to do, and we're working together, mental health professionals with the clergy, and we're trying to work to improve our community as a whole. And hopefully this lasts for many years to come. And I think that's about it for my comments right now. And Steve and I are going to talk a little bit about disclosure, or no, you're going to talk about something else. I'm going to turn.
We're going to feed it. It's going to all fit together.
I'm all confused.
Like those stone cutters, it's all going to fit together.
We're trying to coordinate this really well, but yeah, Steve's going to talk now.
Again, you could hear with Chris's story the theme we talked about in the very beginning, that resurrections occur in places where you don't expect them and don't think they're possible. One reason I do this for a living is because I grew up in a family where mental illness was pretty predominant. I grew up in a world where people died mysteriously and we never found out why. People disappeared, careers ended, marriages ended, and no one talked about it. We just knew things were wrong, but we didn't talk about it. You know, I grew up in a world where I came home, my mother would be passed out on the couch from a suicide attempt. She was unconscious. There's a lot of violence. I was not allowed to go outside because the physical damage was that severe that they didn't want anyone to see me. And this is a world I grew up in. It was a pretty bleak, hopeless world. And when I got out, I thought, well, those people are all disturbed and I'm not, so I'm not going to turn out like them. And I went about my life. I didn't have a lot of hopes because I grew up in a world where nobody went to college, and because of my childhood, I was very depressed and withdrawn, and I flunked 4th and 5th grade, but back then they passed you anyway. But Irene Berkey, my teacher, did point out I would never amount to anything in life, so don't get your hopes up. And so I stumbled through life, but I could write. I loved stories, and a newspaper hired me to write stories, and that was my ticket out. So I survived, I thought. And then I started noticing the same symptoms: the depression, the anxiety, the darkness. I think someone who wrote about depression once wrote about the noontime demon. This darkness would just take over. And then when things go wrong and it has something to feed on, I found myself in 1991, I'd had enough. I know this, you know, I'd taken enough psychology at a community college. I was a behavioralist. I didn't believe in God. I knew how this was going to end. I'm genetically predestined to live out the life that everybody in my family has lived, and that is not a life worth living. And I decided that was it. Fortunately, I suppose, I wasn't a Boy Scout, and I never learned how to tie knots. And so an attempt to end my life was unsuccessful. I ended up on the floor of a garage with blood coming out of the back of my head. And I cleaned it up, didn't tell anybody, went back like nothing happened. But I was gonna succeed, so I started doing more research on, you know, how do you turn off the parts of the brain that control breathing so it'd be a little less violent. And my doctor caught wind of this and put me in a hospital. And so here I am, I'm in a locked psychiatric unit, and it's over. You know, I know how this is going to turn out. My family, my sister wrote me off even though she cared about me. My friend said, that's over. I guess Steve turned out like his family. So if you told me in 1991 that I would be here having this conversation with you, I would have said, you know, you need to be on stronger medication than they have me on right now, because that's just not going to happen. And here I am. And it amazes me to this day. It really does. If you had told me that I would go back to school and I'd get A's, and that somehow I'd get into graduate school and get A's, that I would pass a license exam, that the Department of Mental Health, the people who saved my life, would hire me as a colleague, no way. And that my alma mater would make me a field instructor, you're going to let someone like me teach? Forget it. That my colleagues would think so highly of me that they would elect me president of their union. And then the thing that just stuns me to this day is that they promoted me to program head. I thought, no way. In 91, that just was not ever going to happen. You told me that if you told me that as a single parent I was going to raise two bright, loving, happy children, no way. My daughter will finish her master's degree next month. She's going to be a school psychologist. And 4 years ago, my kids kind of put two and two together because they didn't know a lot about my past. And they gave me a card that said, thank you for giving us the childhood you weren't allowed to have. So that's the why. That's what keeps us going. So, and some of this I've never told anyone before, because when I got hired in the Department of Mental Health, I figured I'm now working with normal people. That always gets a good laugh, doesn't it, Chris? If I told these people... and, you know, I have nothing in common with them. I mean, my clients, yeah, I know the world. I know the despair. I know the sense of anger and depression that they're going through. I remember my first job with the county was Compton Mental Health. Obviously, I stood out there. And I'm saying, these people, what am I going to say to them? I didn't live in their world. But I would sit in a therapy session, and they would look at me, and they'd see a look on my face, and they'd say, you know what I'm talking about, don't you? And I did. And so there was that connection. But I always had the hardest part dealing with my colleagues, because obviously they were, you know, they didn't go through this kinds of stuff. They wouldn't understand, and I would scare the hell out of them if I ever told them my background. And then, you know, there is a group of us in the department who do have these stories. And we call ourselves prosumers, and we're starting to talk among each other a little bit. But then you put me in the session with a client. They look at me. I know how to tie a tie and my own shoes now. And they're looking at me as someone who has it all together. And now I have the power in the relationship. What do I do with that? You know, they're telling me their sense of hopelessness. Do I tell them that I was there? Do I tell them that I'm on 30 milligrams of Paxil? Do I tell them these kinds of stories? You know, and of course the line is you don't. But I found I had to. But as we're going to talk about, you have to be very clear why you're doing it, because you cannot fall into the trap of thinking your story is their story. You cannot use it as a chance to promote yourself. Oh, look at what I've accomplished. You can be like me someday, because then you've replicated something that's happened to them in their whole lives. I realized sometimes I had to be the expert. I had to be the authority figure, because all the authority figures in their life have been punitive, and they needed someone to give them permission to challenge their other authority figures. So what I did in my office is I put a little sign up that only I can see. It said TINAM. This is not about me. So anytime I wanted to do anything that was in terms of self-disclosure, I reminded myself, this is not about me. This is not my story. This is their story. Be very clear why you're saying what you're saying. Are you doing it for your own reasons or theirs? And I tended to be always on the side of caution. But I let them know I've been there. I mean, one person was telling me, you know, I just couldn't accomplish what you've done in life. I said, oh, really? You sure you want a therapist who's been through a divorce and been in a mental hospital for 2 weeks and is on Paxil? You? Yeah. And that person went back to school. And now, last I heard from them, they finished a 2-year degree and they're studying to get into UCLA. But my story told that person, you could make it too. And I didn't go into a whole lot of details because it wasn't about me. So, I was thinking, there's a quote from the Quran that I really like that I didn't mention in the first part. I just want to throw in again. It says that God will not change man. Man has to change himself. You cannot change, it's up to you to have the hope. And that's our job. We cannot change people. Our job is to give them the hope and some skills and some help, support along the way so they can change themselves. And I was fortunate to have all that. Sometimes, I often wonder, why am I here? How did I survive? I shouldn't be here. I'm an outlier. I love that term in college research class. A bunch of us are going to get T-shirts, and we're going to say outliers forever, because we wanted to wreck anybody's psychological research by. But you start looking at grace. I was able to write stories, so a newspaper hired me, and people treated me different than I had been treated growing up. I wasn't the weird kid from the scary family at the end of the street anymore. And I wonder, so where did that come from? What gift opened doors to me that I can be here telling you this story? And that's when some of those old agnostic beliefs I used to have start going out the window, because you have to realize we are a part of something bigger. Because I'm lucky. I feel very fortunate. My kid said, "We're sorry, Dad. You had a really rough childhood, didn't you?" I said, "Hey, look where I am now. Look where you guys are now. I'm lucky because I'm here. I'm still talking." I think that's pretty much. This was the part I didn't know what I was going to say, because you just, it's a very personal and a very nervous story to tell, particularly around some people who are your colleagues and coworkers. But this whole 2-day conference about spirituality and hope, I believe in it because I've lived it. And I see people in my life and in my career beating the odds all the time. People who, if I was in their shoes, I thought, I have no idea why they keep going. And they do, and they make it. And it's not through anything I do. I'm there as sort of I'm along for the ride, but they find a way to make it. So, Chris?
Yeah, I was just thinking, I don't know why I wanted to throw this in there too. It's that I actually have received services from the LA County Department of Mental Health a long time ago when I was finishing college. And then that's when I was a van driver. I didn't have a full-time job. I didn't have health benefits. And remember, I called. I think I was making about $9,000 or $10,000 a year. And even in those days, that wasn't very much. I was living with my parents, and I didn't know what to do. And I think that was when my therapist was really encouraging me to see a psychiatrist. And I called the Department of Mental Health, and I eventually got a social worker somehow. They put me through, and she essentially told me I was making too much money, and that I couldn't get any help. But she was gonna slide me under the radar and let me in, and so I got to see her, and she got me to see a psychiatrist, and I had just. At UCLA had tried that old medicine, tricyclic, and it had the side effects. And it was when Prozac was just coming out. And so she put me on this new medication. It's been helping a lot of people. And she put me up to about 80 milligrams, real high dose, did nothing for me. No side effects, no help. And then so she put me on the old MAO inhibitors. And that one helped me. And so I don't know, it must have been about 9 to 12 months or maybe 6 to 12 months that I was coming to the county, and then I got my job as a full-time research assistant through the UCLA benefits, and I had Kaiser, and then that's another story for another day. Access to medical care, what a deal. So I have. I wanted to talk about the disclosure thing, because as mental health professionals, we're taught to not say too much about ourselves, and not to, we're like the blank slate. And so all the clients' projections can come on us, in a psychoanalytic perspective, and then we can interpret what they're saying as a projection on us. So if they ask us, what'd you do for your vacation? We're not supposed to tell them, right? We're not supposed to say if a vacation was okay. So I remember coming up to my therapist a couple times, like she'd be gone for a month or something. And I kind of missed her. I liked, going to my weekly appointments, and I found a lot of support in them, but I just wanted to know how her vacation was. And so I would say, how was your vacation? And she'd kind of get that therapist look. And she'd say, well, and what does that mean to you? And I'd go, huh? Wow, that's weird. And I thought I was the, client. That just sounded so weird. It's so sterile. And I don't get that. And so now, if I have a picture like of my dog on my desk, and so if a client asks me, well, how's your dog? So my dog's fine. I like running with my dog, and I don't feel like I'm breaking. I might be getting in trouble with my former supervisor, or what I was taught. I'm telling them about my dog, or how was your vacation? Oh, it was really good. Where'd you go? Oh, I went to New York for the weekend. I was at Book Expo. Oh, if they started asking me, well, what hotel did you stay at? What'd you do? Okay, well, there's boundaries here. Okay, right? There's limits. There's some limits. But I'm a real person. And I don't, these boundaries don't need to be this big. It's not the Grand Canyon, okay? It's a small boundary. And so I think, creating an authentic relationship where the person sees that you're real, you have some things you struggle with too, and then there's this issue of, so a patient will say to me, I'm having all these side effects, and I've tried all these medications, and I can't stand it. Some of them work, but they give me side effects, and you wouldn't understand. So I said, well, you know what, I would, because I've had depression, and I've taken medications, and I've had side effects, and I've gotten better, and it's been helpful. But sometimes you got to make a decision about the medication you're using. Is it helping you more than it's hurting you? But I don't tell every patient that I see. I only tell them if I think it might help them. I think it might give them some hope that they can get better, or they feel like, at least I understand what they're going through. And so I don't go by all those rules that say you can never disclose anything about yourself. But like Steve said, you got to be really careful, take it really seriously, what you're going to tell and who you're going to tell and when you're going to tell them. It's for their benefit. I'm not telling someone about my problems so I can get a listening ear. If I need a listening ear, maybe I'll call Steve or something like that. Or probably, maybe not, but. I don't know. I just thought I'd throw that out there.
Well, I guess there was something when Reverend Murray talked yesterday. He talked about an individual in his life who passed on, and still he's living for that person. And before we open the discussion, I'm just going to be a little self-indulgent here, because there's an angel in my life I would like to thank. When I came out of the family I came out of, I developed a very close relationship with a person who died of Hodgkin's disease when I was 20 years old. And the last time I saw her alive, she gave me a letter, which I still carry, and it said, "You are more than what people have said you are. Remember that." And when I graduated from USC, I had that letter in my pocket. So I just kind of want to say to Lisa Luce, thank you. So. I think that's the Lions part of our presentation. This is, we'd like to open it up for comments, questions, thoughts, ideas. Dwayne.
I have a comment. I'm a consumer also. I also work with Dr. Camilleri, and I'd like to thank him for treating us with the respect that he does. Yes. He treats us like we're professionals, just like him.
Well, thank you. Thank you.
He's a pleasure to work with. Anytime you need help, he's there to help you. Even when he's really, really busy and he's up to his neck, he always finds time to at least give you words of encouragement or tell you, wait a few minutes and I can help you.
Well, thank you, and I want to thank, Dwayne is always helpful, and he might be in the middle of something, but I might have a client that's asking about, well, they want to get glasses and they don't have insurance, and he's the one that is our connection for lens crafters, or he's doing the job stuff and the job referrals. And so I'm talking to a client that's, has financial stress and they lost their job and it's the recession, and you know, and they're looking for work and they're having trouble. And I said, well, we got this peer advocate, you know, Dwayne, and you want to talk to him? And yeah, so I'll go call Dwayne, and he'll come in and he'll help out right then and there. And so it's a good, we have a good work relationship. You know, except when he talks smack to me. Then
I think we have a question or comment over here.
Yes, I'm also a consumer recovered, and I work with the Los Angeles County Client Coalition. We have a lot of very special people there that are advocates for consumers recovering from mental illness and doing a good job at it. But lots of times, persons in the coalition themselves are experiencing some trauma, but I think they're in sort of like in denial, and I kind of wish there was a way that the staff or maybe some of the consumers could kind of direct them in the right way. There's a lot of anger and fighting lots of times, and it distresses me certainly, and it's been a great problem for a long time, and I just wish something could be done about it sometimes.
yeah, that's a frustrating thing. You know, I've been to a couple of the meetings, and I've heard about that. That anger is, you know, Dan Fisher's a psychiatrist, and he's an advocate on a national level, and he always talks about turning your anger into passion, and you got to channel that energy in a way that is useful. And you know, that I don't think that's an easy thing if people sort of are not really conscious of what's going on. And
Maybe we could have a spirituality workshop at the office sometime. A group or an ongoing group or something like that.
would you like to have a spirituality conference with the Client Coalition, or?
Like kind of like a workshop.
Well, yeah. Well, we should talk about it. Maybe we can set something up.
One day after.
It's going now where I work. If we can get some items, and I'm doing a little promoting here, Anna. And you know, because when the clients come in and they see them, that's the first sign of hope. You know, I used to do an orientation group at Arcadia Mental Health, and we would give our spiel, and they would patiently listen to us. Then the peer advocates would get up and their attention would come up because they'd say, there's the next step in my life. That's where I can be someday. And so you know, that's one of the things, and one of the things that's important is to advocate for yourself. When first happened, there were some people that were nervous about it, and they came to me as the union president, and which I was at the time, and I said, you guys, I'm a former consumer, so watch what you're saying, because I don't appreciate this. You know, I was one of them, so be careful when you start dismissing people like that. So we got a couple of hands here.
It's been since 2005 that I've seen Camilleri. Camilleri left us a couple of years back. I was released to his office in Lancaster when he worked there. Now I'm a peer advocate. I'm studying. I feel better. I want to go get those guys that hurt me. I don't want a vengeance, or I feel a lot better, even though my body's still hurt from what happened, and I think it works, and that mental health is helping. Except Truman Wong, the guy that they left in position, he kind of comes up with those little bad words, and it's not my damn fault that, you know, he gets me on my toes, and I speak to him, and hopefully I can learn a little more. Thank you.
Oh, that's great. Oh, thank you. You're welcome. Thank you.
I don't think there's any doubt about the fact that peer advocates or peer specialists really contribute to the recovery environment in the department. But do you think it's possible that when clinicians stay closeted about their personal experience, that actually contributes to stigma and discrimination?
I do personally. I'd be interested in other people's comments on that.
I think that it works both ways. The reason they keep it closeted is because they're afraid of, if they say they've had a problem, what the repercussions are going to be. And are they going to be looked at differently? Are they going to be watched more closely? And what if they do start having a depression or a problem, and then are they going to be questioned about their license, you know? And so I kind of, I mean, the cat's out of the bag with me. I can't take it back out. So it hasn't caused me a problem yet, but you know, I was taking a risk when I did it. You know, a couple years ago, Bobby set me up with Dr. Southern and the advisory board, and that they seemed to be pleased, and I haven't had a problem. And so I think that, yeah, so the reason that people don't say things is because they're worried about the stigma. But if they did say something, they're taking a risk, and that could help. Oh, Dr. Southern.
To build on that, the risk is not,
Could you?
the risk is not made up, that there have been professionals who have had an incident, who have disclosed and had their caseloads taken away from them, for example. I mean, it's not that that happens all the time, but it's not, that disclosure of a past history is not risk-free, and therefore, that's why I believe it needs to be an individual, personal decision, as you've indicated, because it depends on your circumstances and your supervisor and the atmosphere. Now, I think we have, in the public mental health system, come a long way from where we used to be, and so some of the stigma and prejudice and discrimination against people with mental illness has decreased quite a bit, but it's not to say it's completely gone.
What do you think we can do to push it to the next level?
That's my next question.
So that more and more people feel like it's safe to talk about it.
Well, I think the answer to that is, to quote somebody famous, by the fruits of the tree you will know them. And that I think the process of disclosure and the improved outcomes that that creates will spread, and people will know that, you know, that it is useful. I think, for example, you know, I didn't know really the background to Steve's story until today, but what I did know is, in working with him through the years, that here was a mental health professional who had a deep commitment to clients having better lives. I mean, so I didn't know the why of it or the how of it, but I knew the fact of it. And I think as we see people doing better and more supportive work, and these things come out, not like you say, I think a really important thing. It's not about me. You know, that's not the focal point. The focal point is how we can support clients and families better. And I think that's the direction. So I don't think a dramatic thing is the next step. I think it's a evolution of making the whole system more recovery friendly. And as it becomes recovery friendly, then it'll become less and less of a big deal. Anyway, that's my.
Well, thanks. I wanted to actually put the question to you guys. So, we have a program head here, and we have a psychiatrist. We've both been in mental hospitals. We've both been treated by psychiatrists. And I for, you know, over 20 years and off and on. And so how does that sound to you? How does that feel to you, knowing that? What's that like for you? Does that, if you're a mental health professional or you work at the Department of Mental Health, does that make it seem like it might be easier for you to tell someone? Or, yeah, what's it like for you guys that you're hearing us say this?
Well, that'll be alluded to what I wanted to say, which is, and I'll introduce myself as a person who has come through the door of consumerism into professionalism. I'm a clinician, licensed, through a very hard process. But I want to speak to also what Dr. Southern was saying about how it gets better. And I think this conference and the kinds of content of this conference are really one of the ways it gets better, because it is in the arena of spirituality where we all recognize our sameness and the fact that we are all having to struggle with being at the same time both separate and unique, and also longing and needing to make connection, which is true about every living person. And when I think about the disclosure issue in work with a client, much I do or don't and how I do it, I've come to think about it as that doing therapy and being in therapy, it is an effort to create a container. To create a container that can hold what is our life stuff. The vase, perhaps. The vessel. And that we as clinicians help people to learn how to strengthen and maybe weave or paste up or whatever, put it back so it can contain. And one of the ways that we can use ourselves is by acknowledging that we are all broken and that we are just another example of a being that has to learn how to be a container that is able to let in light and survive the seepage away of things that may be precious to us that are sometimes that we lose. So this conference has been really incredible for me personally in terms of integrating a lot of things that are part of my personal, spiritual, professional journey. I'm
Right.
just deeply grateful for it.
Thank you.
We had a couple of hands over here.
Yeah, okay, I've seen on different issues. I was in another meeting when I was spoke about the churches. I've seen a lot of the churches, the priests or the minister are nice to the people with mental illness, but then they have a social night or social activities, a coffee house, and the person with the mental illness go to social activity, right? And other people that don't have the illness, the person with mental illness alone on the corner. Nobody talks to the person. Nobody comes near to say, hi, how you doing? Hi. You just sit there alone, eating alone by himself. They know he has a mental illness or he's alone. And they know he has a problem with mental illness, so they don't even get close to that person. And that's a big problem. You know how that makes you feel of that person? How with that illness will make you, it will build that self-esteem you have already will go lower and lower and lower. The hopelessness. So I think that happens a lot in a lot of social events. Somebody who's I'm not saying you guys, but a professional see you in a party, you don't even come and say hi because you're embarrassed or whatever the reason is. It's a problem for a lot of people. I've seen that happens a lot. Person with a mental illness, you don't even, it's like you're ashamed to be not that person. What do you guys think about? I've seen that a lot. That happens to me a long time ago.
I think we had a comment over here to a question or comment.
No, I was thinking about what you said about disclosure. Who else better to help another person if he hasn't been there? I mean, you've been there, so isn't it better for you or for the client to know that you've been there?
Well, I think that it's, for some clients, I think they appreciate that, that I could understand what it's been like. I mean, something like I haven't heard voices or had paranoid delusions or something like that, but I have the understanding of what it's like to feel like your thinking apparatus or your ability to concentrate and have access to your emotions is just kind of ripped away from you. The feeling that you're powerless. And so I think that's helpful, but I think there's a lot of people who haven't had a mental illness or a serious mental illness who are very passionate and very helpful and very empathetic. And so I don't think you have to have had a mental illness to be a very good clinician. That's not necessary. But I think there's a special gift that someone who's been there, who's stood in those same shoes and walked that road, although it's not the identical road, but it's a similar road. I think that's helpful.
I had that problem myself with a professor in university. I'm taking psychology also. And she was talking about life, and I corrected her, with something that she said. I said, no, it's not like that, And she says, and then she jumped on me and she said, well, you know what? I am the professional here. And I looked at her and said, oh my God. I said, well, I understand that, and with all due respect, I respect that. You are the professional, but lady, I am the
One, now there is another side, and we'll get to you in a second. There is another side to the recovery that one of the things, I think one of the disappointments for me as I got better was that life didn't get easier all the time. Because the more you grow, and I'm sure Dwayne and a lot of our peer advocates, as they move into community workers and other positions, will tell you, the more you recover, the more responsibility that you now can accept. It doesn't become a reason not to take things on. I mean, program head is a very challenging job, particularly when your first year and 3 months. And when I have a really bad day, I say, "Oh, thank God I've recovered enough. I can take this on." But then sometimes I think, well, maybe I'm Icarus. I jumped too high, and But I mean, that's part of the responsibility as we grow. Life gets better because we're capable of more, but life asks more of us. So, you have a comment or a question?
Yes, a lot of our work, sometimes we fall into a situation where it's a us and a them mentality, which I think is very, very wrong. And whether it's based on spirituality or disclosure, or whether it's just being inclusive, I think we will see progress. And which one of those it is probably has to do with the appropriateness of the situation, much like you were describing. It's not about you, it's about the person that you're working with. It's if it would benefit them instead of benefiting you. And as long as we all can remember that, I think we can make a lot of progress together.
This gentleman in the back.
I guess I wouldn't come from the consumer, but I would be what Chris was referring to it. I'm the team leader for a contracted agency in service area 7, and we telecare. And we have two. We just finished with an intern. We have two. Consumer advocates, PSC ones, and we have two who have graduated. I mean, have gotten promoted and they're PSC twos now. So, good portion of our team is consumer advocates. And what I really think is a difference here, and I think with this conference, is the whole idea of hope, and how important that is. My own personal struggle, I'm a team leader now, I'm a licensed social worker. It took me a ridiculous amount of years in order to earn my degree and my license. And if I didn't have hope, I wouldn't have got there. I work with people who've been working for years and years, and I work, meet my cohorts who work for the county, and that it gets discouraging because that hope isn't there. And I think as a social worker, I really look towards the psychiatrist as they're at least they're the person who has the highest degree, or is getting paid the most, or has the because of all the schooling they have. I think we all look to them for their knowledge. And when that person on the team doesn't have the level of hope, when they haven't had the experience, and a lot of times I feel like they get their sense of hope or their outlook by the percentages. And the way the percentages work, that a lot of people they've been diagnosed with a chronic illness, and they're treated that way as it is chronic, and it's as in something that won't really get any better. Whereas I've heard that Dan Fisher talk at the conference, and for him, he talked about just the importance of treating the people you work with as people. And that was the thing that was most important for him when he was going through the system. And as a psychiatrist, that's he stereotype would be that there's no hope, that there's not caring, that it's the system. And having met you today, you know, I know that's just a stereotype, and that's not true. And within the within the system, there's people with no hope, and within the system, there's people with a lot of hope.
Well, thank you very much. I really appreciate those comments, and that really kind of resonates with me. What you're saying, you know, kind of look to the psychiatrist for saying there's some hope, and I feel that's important. You know, I mean, yeah, I mean, so we have a lot of education, but it doesn't necessarily mean if we got the right kind of education, but you want to hear from, you know, that someone who's got this education, yeah, that there's hope, and there is hope, you know. And sometimes, you know, when I've talked about hope and people can recover, you know, and then people say, well, are you going to give people false hope? And no, I don't think so. I mean, I don't want to give them false hopelessness. And I want to give them the hope that, yeah, they can get better. I mean, do I know how much better they can get? Not exactly, but they can get a little bit better. You know, if they get out of the house once a week now, maybe they can get out twice a week, and then maybe 3 times a week. And maybe they could start, you know, go to a church, you know, 1 Sunday a week, and then 2 Sundays, you know, a little bit more. And I think if the mental health professionals, you know, we are the ones who supposedly know the most about mental illness. And so if we have hope for people can get better, then the community and the police and the fire department and teachers are going to probably start having more hope. And the patients that come and see us are going to have more hope. And there's a group called Community Activators. Bruce Anderson, you know, is on that, and I've heard him speak. I like his website. He's got sort of, I think, a number of links or pages on that talk about how to create a culture and environment of hope. And I think that's a good one to read.
We have a question over here?
Yeah,
Or a comment?
that was more of a comment. I just wanted to say that, you know, in terms of self-disclosure, hearing you both speak, just kind of validates for me the self-disclosure that I tend to do with my clients inappropriate. And it just, because there is so much stigma to it, and so to hear you both speak of it, it just kind of validates for me that
Well, good.
doing anything
I'm glad. I like it. That feels good to hear that. Feel like we're doing something that's having an impact. Thank you.
I was thinking, because from my staff over here, Maria's here, it's like, do I tell my staff this story? Because I don't think I ever did.
Okay, but do you want to know my reaction to it? I think all the more of you because of everything that I know of you. You know, how you brought up our clinic and how you have created relationships like we didn't have before. And it's just, I mean, I look up to you, Steve.
Oh.
I mean, it's beautiful.
Well, thanks. And I know we're going to be wrapping up soon. There's a lot of really good seminars this afternoon. So the fact you guys chose ours means a lot to us. There's a lot of really tough choices. And I told my staff, don't feel like you have to come just to be nice to me. If you want to know what I have to say, I'll tell you privately, you know. But we really do it means a lot to us as 2 recovering people that you guys thought that we had something worth saying and that you participated with us today. Thank you very much.